Good morning. We will continue with the training for skill clinician documentation for effective and proper documentation by the skilled clinicians on Netsmart and Devereaux. Today we are going to focus on page 5, 6, and 7. For the presentation, for right now, the focus will be on page 5 and 6 on Netsmart and Devereaux. Page 5 and 6 is basically for the clinician to document on AM care treatments and PM treatments. Okay. It's for AM care treatments and PM treatments, indicating that while you were with the client that you did provide some care during your shift. If you don't document anything on this, it's as if you did not provide any treatment or any care for the client during your shift, during your skilled nurse visit. This form is very simple and it's to the point. It's not complicated. The treatments are on here. It talks about, and you have your times for AM. You have your times for AM depending on the time of your shift. And that's on page 5. And then you have your time for PM depending of the time of your shift. You will select your time when you provide any treatment or anytime you implement patient care. And like I said, it's very simple. If the client has equipment that have alarms and monitors like ventilators, pulse ox, things like that, you have to document your time here, that you are aware that you are checking the monitors on the ventilator, on the pulse ox, and that they are audible, that you are able to hear, that you are able to hear the alarms on ventilators and pulse ox with their settings. So you will select your time, acknowledging this. It's basically say, this is your time, and you're acknowledging as a clinician that the monitors are on, the alarms are on, and they are audible, and that you are able to hear. And that's the same things for pulse ox readings, and you can put your pulse ox reading here. Okay. Let's say if it's 98%, whatever it might be, if it's 100%, whatever it may be, you document that here, and you document your time, that you acknowledge that your monitors and your alarms are on, they are audible, and you're able to hear them. And you document your pulse ox readings here. The same thing, if the client is on oxygen, you're gonna document that they are on oxygen, you acknowledge it, whether it's continuous or when needed, you document that. And then T here, as you can see, T is for tolerated. If the client is able to tolerate the treatment, you're gonna put a T, okay? If the client is able to tolerate the treatment, you can put a T here. If they are not able to tolerate the treatment, you're gonna write NT, meaning not tolerated. Okay, and whatever the treatment may be, 98%. And over here, you can put your comment. Let's say if you put NC that the client was not able to tolerate the oxygen, okay? For whatever reason, you can document that in here, and you can expand this, okay? to do your documentation. Add any comment. If the client doesn't tolerate any treatment whatsoever, if they're not tolerating it, there has to be a comment to why they're not tolerating that treatment. Okay, otherwise you can put a T indicating that they are able to tolerate the care that you provided. Your implementation and intervention. Here is like when, when you turn and you reposition a client, let's say add a bed to chair, add a bed to a wheelchair, or from the chair to bed, or from the chair. Sometimes you'll reposition your patient from the chair to another setting. Uh, let's say if they have to do physical therapy, you might have to reposition them to a different setting in that environment. So anytime you move the client from one position to another position, you have to document your time and whether they tolerated it or whether they did not tolerate it. And you can always put your comment in here. If you put a T, they tolerated it, you don't really have to put a comment unless you want to add a comment. It's always good to write a detailed comment in here. I would recommend that. However, if you put NT, not tolerated, anybody who picks up your chart or who's reading your chart or wherever your chart finds itself, if an auditor is reading your chart or somebody is reviewing your chart, a physician is reviewing your chart, they have to understand why did the patient not tolerate whatever care that you were providing. They need to, it needs to be clear and understood by anyone who is reading the client's chart. If you put NC, you have to add a comment. If you put T, you don't really have to. However, I would encourage that you do so, you know? And then if you do range of motion, passive range of motion, that's when the client is not able to do their own range of motions. They're not able to perform their own range of motion by themselves. You have to do it for them. Let's say if they have contractures. If they are contractures, they are rigid, their muscle tone is very rigid, they have spasms and tremors with contractures, they're not going to be able to do their own range of motion. You will have to do it for them in order to increase their mobility and their muscle strength. And when you do this, if they are able to tolerate it, you put a T. If they're not able to tolerate it, you put an NC, and always add a comment. If you put an NC, you have to add a comment. So anyone, even if an auditor is reading your chart, they can understand why did the client not tolerate it. Okay. And then your daily care, whatever care you provided as a clinician, because you have to provide, some treatment while you were there during your shift. All right. If you give them a bath, whether it's a shower, tub, whichever bath that you give, if it's in the tub, you gotta say you give them a bath in the tub, and if they tolerated it or not, or whether if it's a shower, or if you cannot get the client to the tub because they are not able to walk, you have to do it, in the bed. You document whether they tolerated it or not. Okay. If it's a shower, you can do that too. If it's a shower, you can document that too. All right. And then if you do AccuChecks, checks, if they are diabetics, you do a blood sugar check, you document that. Ketones, if you provide catheter care, any kind of care, nebulizer care, if you do chest PT, whichever chest PT you perform, if you did cough assist, if you suction them, whichever kind of suction you provided, let's say if they are either on a trach or a ventilator or whatever, then, you will document that as well. If they are on NG tube feeding, things like that, this is where you document that. Feeding tube change. If you change the feeding tube, if you change the bag, if you change the bag of the feeding tube, you have to change it at least every 24, no more than 48 hours. Okay, 24 hours is a good time. However, it should a feeding tube bag should be changed within 48 hours. It's good if you do it every 24 hours, even every 12 hours. You know, if they have a lot of supply, you can even do it every 12 hours, every 12 to 24, no more than 48. Um, you have to document that. If you don't document that here, that's mean you didn't provide it. You didn't provide that treatment. And you have to be able to show that on your chart. We have to be able to see it. If your client is on any G-tube feeding, we have to see that you are changing the bag. And that's another part, to prevent, infection control. That's another part of infection control and all that good thing. All those good things. If you have to vent your G tubes, you have to document that here. GI vented. If you do ostomy care, if you do ostomy care, let's say they have an ileostomy, colostomy, ileostomy bag, you gotta document that here. If you do trach care, you gotta document all of that here. If you do other treatment, you have to document that. For some clinician, when I look at this page, nothing is documented on here. It's telling me, even if you put in your notes that you provided some care, if you leave this, you don't document anything on here. When somebody is reading your chart, that's when you did not provide any care or treatments that were needed to the client. If we're looking at this, there's nothing on here. Okay, there's nothing on here. All right, we're not seeing anything, like this. When I review your chart, I gotta see that. Okay, I gotta see this. As I'm reviewing your chart, I have to, as I'm clicking, I have to see these things on either page 5 and page 6, or on either page 5, page 6, or both pages. Like as I'm reviewing it, I have to be able to see this, you know? Uh, you're documenting your time. All right? You're documenting. And then anybody is reviewing your chart, they're gonna see that, you provided, care to the client, by just saying that. If I see a T in here, sometime I'll just look at it just to look to see if you add any comment in here. If you don't add any comment and you have a T in here saying that it was tolerated, then we're good. However, if you put an NC in here, you have to put a comment in here. All right. Mm. And then you save your documentation. Yeah, when we click on page 5 and 6, we want to see that your T's are marked, indicating the client tolerated the care that you provided, the treatment you provided, and the time. If you leave this and you don't document anything on here, you don't click on any T's or any NC's, that's when you didn't provide any care to that client. And I will send a chart for correction. Okay. I will send a chart for correction because it doesn't look good. If an auditor is looking at your chart, or wherever your chart finds itself, it will not look good. Okay, because that's the reason Netsmart and Devereaux have page 5 and page 6, showing the treatment that was provided to the client by the clinician. We have to show it here on page 5 and 6. And then you have to click save. After you've done all the work, all the good work, you have to save your work, okay? You have to save your work and your documentation. If you have any question, you can always send me a text message. You don't have to put the client's full name or the client's name because of HIPAA, and then I will respond. Thank you for your time.